And here's what's at stake for the people of Ontario because of Bill 60. More costs for patients and more uncertainty about what those out-of-pocket costs might be. Private clinic surgeries that will cost taxpayers more than double what they would in the public system. Right here in Canada, the data shows that provinces that have outsourced surgeries to for-profit clinics are waiting longer than they are even in Ontario.
It will poach the staff from our public healthcare system. There's no magic poof of human resources. Shortages in hospitals will be made worse, and hospitals will be left with all the complex cases as private clinics skim off the easiest patients. How does that make sense?
For 100 years or more, literally hundreds of towns across Ontario have worked to build their local public hospitals. Those communities have donated. They've donated through their payroll deductions to their local hospitals. They have fundraised. They've volunteered. They have literally built their local hospitals.
Oversight is left outside of the government to a third party or multiple parties, and that they're given wide discretion, powers, and responsibilities, including sole discretion on licensing and establishing new classes of service. Wow. That is a big wow. Total lack of transparency, no requirement to gazette any new clinics or anything. It opens up huge possible conflicts of interest and possible corruption, as they're not subject to any public disclosure or public reporting.
It is completely unneeded. Ontario has operating rooms in every public hospital across the province that are underused. We have operating rooms in virtually every hospital that are closed for days, weeks, months at a time, even permanently, due to underfunding of those hospitals. The claim that this is the only option to deal with the surgical and diagnostic back is utter nonsense. It is completely false. So why then privatize? In whose interests is it to hand over these vital services from our public, not-for-profit hospitals to private, for-profit entities? Well, the only people who benefit are those private, for-profit companies, which begs the question, is that why this policy is being followed?
Bill 60 is not the answer to Ontario's healthcare crisis. Investing in our public healthcare system, staffing it properly is the answer. Our lives are not for profit. This is not our healthcare act. This is your healthcare act. It will only benefit a few, and our lives are worth more than that.